and welcome to HealthTech Pigeon, brought to you by the team at SomX, where we do a quick post-mortem of the best health tech stories of the week every single week. I'm Huw, and today I'm joined by Aahuti from the SomX team and this week's guest, David Joerring, CEO of employee health and wellbeing platform HealthKey. David, I'm super interested to hear more about HealthKey and learn about what you've been up to. You had some big news last month, and I want to ask you about that. Before we do, I just want to take a quick moment to shout out to Aahuti, who has stepped into SomX on an interim basis over the last month, and by default has become my go-to co-host for Pigeon for the past few weeks. It's Ahuti's last episode as a regular guest, so I just wanted to take this moment and thank you so much for being part of the Pigeon team. If the reception to you on social media has been anything to go by, we can't let it be your last appearance. So I really hope you're prepared to come back week in, week out over the next few weeks. So thank you so much for that.
That's amazing, Huw. Thank you for the shout out. I will always be your plan B, plan C, plan D, whatever, to come on to the podcast. And I think just the last sort of few weeks of being on it, it's just been incredible, the kind of thinking that goes behind each episode and the curation of the stories and thinking about which guests to bring on. I hope all of the audience, I guess, of the newsletter as well as the podcast, appreciate that actually you're really trying to bring them news that matters and news in a way that's digestible and can be processed. So it's a great platform, and thank you to you and the team for everything you guys do.
That's lovely words. I mean, normally when we thank people, they give us a joke and talk about our puns, but it's nice when something more with meaning. David, you are CEO at HealthKey. You recently picked up £1.1 million and as one publication put it, to revolutionise how health and wellbeing services are paid for. We did feature the story back in April in the newsletter, but we didn't dive into it too deep then. So now we've got you with us. Do you want to tell us a bit about HealthKey and the story, I guess, behind that headline?
Yeah, definitely. And thanks for having me as a loyal listener for a while. So it's great to be on. I think it sounds great to sort of revolutionize how healthcare is paid for. But healthcare is really born out of sort of three core beliefs. The first being that the proactive and preventive health is a good investment. It's not just something that we should do because it helps people be healthier, but it's actually also economically good investment. The second being that the best health providers usually specialize, and it therefore takes a fragmented, sort of large ecosystem of providers to get good service. And then finally, that it takes multiple stakeholders that are interested in paying to keep people healthy. So it's not just our public health systems, it's not just us as people, but it's both health systems, us as individuals, employers, and insurers. And so trying to match up that fragmented ecosystem of providers, health providers, with a fragmentation of different payers, there was a lack of infrastructure, how to bring that all together so that people could benefit both from the services that are being created and from each of those stakeholders that actually have an incentive to keep us healthy. And I have a background as a health tech operator and had been selling in products, health products to these different payers, and realized there's the interest in doing more in prevention, the interest in doing more proactively, but they couldn't really get it delivered, and usually lack of engagement, lack of technical integrations. So set up HealthKey as really to build what we saw as missing link as an infrastructure. So integrating with a large network of providers, a large network of payers, giving it to the end user to be able to easily see who's willing to pay for what can I access, so you can get personalized care from that range of different payers, and that they can collaborate. So your employer is willing to pay for something and you might add on to it. Your insurer is willing to pay for something, the employer can add to that. Public health can invest in it. And so really bring more collaboration into the way that healthcare is accessed and is paid for. I
mean, there's quite a lot to break down there. And I think it sounds like a very important gap that HealthKey's trying to fill. The one that comes straight to mind to me is that I guess that process of being a health tech and selling to an employer, first of all. So I think that kind of stands out. And this kind of addressing one of the common kind of challenges that people are putting forward right now, that it is basically impossible as a fairly niche health tech provider to go employer to employer to employer to sell, a fragment of a wider healthcare service or a wider healthcare plan. Chrissy Farr's talked about this quite recently in Second Opinion. The employer used to be the go-to, and it's now becoming much, much harder. Is that kind of a critical element that you're looking at, or is there kind of a wider piece?
Yeah, so it's definitely it's a big part of it. I think what we found is that you're solving multiple problems. So building a really good health tech service or product, you need to solve a great problem for the end user, which is the employee. But actually, to sell through the employers, you also have to solve a problem for the employer and for the HR person. And a big part of that is the procurement and the delivery and the management of that, which is really usually where those great but slightly niche products sort of flounder. And it's very hard to get an HR person, even in a very large enterprise, to onboard 25, 30, 50 different suppliers and manage those relationships and get it out to their employees. And so what we're trying to do is say, each of these providers, we can do the procurement, we can do the clinical due diligence and the data governance and everything, as well as the integration for the end user. Give it to an employer as here's a single relationship. You just need to pay one place. You just need to provide one front door to your people, but you get access to this wide range. And particularly for the health provider, what we want to help them do is focus on your product. Build the best health service that you can, but let the procurement and the sale into employers, we can take care of that side. Because I think my experience was previously that you could end up spending much more energy and time as a health company actually working on sales and procurement efforts and integration into payers than on the product, which is your core competency and where you want to spend your energy and your time.
Interesting. Aahuti, I'm sure you've got questions. I've got one more, which is, in terms of your sort of target employer audience, are you looking at the kind of SME market? Are you looking at larger corporates? Who is the ultimate customer?
So we I think maybe slightly untraditionally don't see it so much as the sizes, but we're looking a lot at employer groups or industries that don't traditionally have access to a lot of health benefits. So think of traditionally, if you're selling benefits, you go for law firms and banks and tech firms that have a lot of cash and there's a lot of budget for each employee. And that they've been quite well served, but there's a large group of industries from social care homes to construction that traditionally don't have a lot of benefits and where it requires really cost-effective solutions, but also really easy delivery. And so we're trying to look specifically at areas that are underserved when it comes to health benefits.
And I guess I was curious about something. This might be putting you on the spot for a bigger question that you had intended. I'm curious about what your future outlook is based on all of the work that you've done. You're kind of in the heart of the ecosystem in terms of this particular vertical, and it's quite a crowded space, isn't it? And you've kind of got the traditional providers in the space that are they have propositions that still matter, but there's this kind of fusion. I kind of see this picture in my mind of these circles of different providers, and they're providing slightly different things to this population and this vertical, and things are just starting to fuse and blend together. So I always kind of struggle at the moment to really make sense of the sector and who's providing what. And I'm just really curious about if you have got a future outlook of how you think this will get organized moving forward. Are we going to kind of see certain subsectors here, occupational health providers, employee assistance providers, really dropping off? Are they just going to disappear off the scene and they're going to be overtaken by newer providers that have got more up-to-date propositions? How does this tie into your vision about what the government is doing or planning to do? And I'm sure it will be in most manifestos of the political parties around getting people back into work and employee productivity. So I know that's like a really huge question that I'm asking you. I'm really aware of that. But you must have some really rich insights because you're in this space and you've traveled in it for a while. So yeah, anything you can help us understand about that?
Yeah, I think the first part of the question, I think what we're seeing and probably expect to see more of is that the traditional model of having a product that is available to all employees and everyone gets the same service. So there's a mental health provision, and that is the one that everyone gets. And it's sort of pressure very low price. And we see with the EAPs, and it's sort of, here's a base level. I think we're going to increasingly see a wider range of offerings that are specific to smaller groups of a population. Because finding that what we can see is that those that the end user likes best are usually more specific. And so they are targeted and they don't need to cover 100% of the workforce. They could be great for 5%, 10% of the workforce. And so I think there'll be a wider range and that more move towards personalization. The expectation is also going to be that we can match people up with something that really fits. So the example in mental health is we've had these well-being and meditation apps, but increasingly we're now looking at if you have social anxiety, that's a specific challenge. It's different from depression, and depression is it's a different pathway. And some providers will cover multiple pathways. Some will be unique to a single pathway, but it will, I think, unlike other industries where you see a consolidation and then there's sort of one player wins the market and becomes the mental health service across, I think the nature of healthcare being so complex, it's unlikely that anyone's going to be able to do that and do it really well. So what will likely be the best solution is to have and build a way. Obviously, I will say that because that's what we're trying to do, but be able to provide much more niche services. I think what also in terms of the second part, how this fits in politically and in terms of communities, we're increasingly seeing that there are other groups of payers, not just your employer or traditional health insurer, but a wider group that are interested in improving their core propositions that might be from a union perspective or other types of insurance or membership groups that are adding on some health or well-being services to their core propositions. And it's probably a function of the challenges of our public health systems. And people are looking at it with sort of waitlist in NHS, cost of living crisis, but there are increasingly people seeing supporting people's health as a way to improve other propositions. So we're also getting this fragmentation of different types, whether it's your gym membership that's adding on digital services or your union membership that's adding on some health provisions. And so we need to, instead of seeing those as competing with your employer benefits or competing with the public health system, we need to find a way for all of those to work together effectively. Because it's a great thing that there are more organizations, there's more stakeholders that want to help people be healthy. The challenge will be, how do they collaborate? How does it become a beneficial thing to have multiple stakeholders and not just muddying the waters?
I mean, it strikes me listening to the first part of what you said in terms of the landscape and the number of providers and what they will end up providing in terms of sort of niche cohorts, is it requires two things. I'm probably oversimplifying this. It requires two things. It requires a really granular understanding of that employer landscape and how do we define and identify those niche groups. And very often startups are not equipped, with skills, resources, time to be able to do that level of strategizing and analysis of a marketplace. Very often companies that are coming in with new solutions are very much, let's just kind of spam everyone, see what sticks, because that's just part of the ethos of doing product market fit iterations in the early days. But the other thing that strikes me here, in terms of what we're going to need to really leverage and make really good use of all of these solutions out here, which are offering very different things. And as you said, a real kind of personalized approach, is employers need to have an understanding of their employee needs. And they're going to be sort of a bit more dynamic, I think, as well, because as the business ebbs and flows in terms of its own dynamic in the marketplace, they'll have tough times, they'll have good times. It kind of also correlates to how the employees feel about being with that employer. And if there's not a good way, an efficient way, an effective way for those employers to be on the pulse of that in terms of what their employees need, then they're not going to be in a position to bring in the right solutions, which then means they're possibly bringing in the wrong solutions where they then don't get the return. And then it almost creates bad press for some of these solutions. And it's not necessarily that the solutions are not the right ones. It's just that match of, employee needs and the solution. But it starts with, an employer understanding those needs, because you're not going to know those needs from the outside in. What you can do is strategizing around which employers you're targeting and why. But the employers need to kind of be in tune with what the needs are so that they put their money into the right solutions and then start seeing the returns. So I've probably oversimplified it, but there's lots of layers to this.
Yeah, and I think you're exactly right. I think the thing to be mindful of is that we can't expect either side to have that knowledge up front. So the an HR team and the employer traditionally will not necessarily have the understanding of exactly what people need. So there's a data capture element and turning that into insights and being able to do it in a way that keeps the privacy of the employee, because we want the employer to help us get the right things, but there's a lot about our health that we might not want to share. And so we do a lot of work about how do we help them capture those insights, but in a way that still protects the employees. And at the same time, being able to present those insights the other direction, because exactly as you say, a health startup will not have that information. And we shouldn't necessarily expect them to be experts in the go-to-market and the landscape of the employers or the insurers, because that, again, I think is throwing a lot of resources that should be spent on improving the health product. And so what we're hoping is that improving the infrastructure that they both can get onto, we can take the insights from the employers, help the providers of health services reach the right employees, but through very simple integration, then focus on what are they building, get the data from the first users and use that to then deliver it out to the people that need it. But it's ineffective for each provider to basically just spam out every employer and say, well, we'll throw one at the wall, see what sticks. And it also inundates the employer. So I think all HR managers or well-being leads will feel inundated with the sales teams reaching out with a new health product. And that really just isn't great for the ecosystem, because it's very hard for them to assess what is actually a good health service, what do our people need. And if you get hundreds of emails every week with a new service, you end up just sort of, it's too much. You sort of close your eyes and can't get into the details.
Interesting. Well, I think this is a conversation that we'll definitely carry across several of our stories today. So without further ado, let's move into story number 1. So our first story today comes to us from Tech Funding News. That is that ifeel cements $20 million to address rising mental health costs for businesses and insurers. So ifeel, a European provider of mental health solutions for corporations and insurance companies, has secured $20 million in Series B funding in an investment round co-led by TLV Ventures and Corellia Capital. The round will fuel the company's growth and product development efforts in the mental health care space. Mental health issues are a growing concern for both businesses and insurance companies. Studies show that employee burnout, anxiety, and depression are becoming increasingly common, leading to increased absenteeism, presenteeism, and higher healthcare costs. ifeel's approach, they claim, to corporate mental health offers a promising solution for businesses and insurers struggling with rising mental health costs and a growing demand for accessible care. So I think this probably ties in very neatly to what we're talking about at the moment, and the kind of various offerings that are available to employers and how healthcare companies are selling in. David, you've had a look at the story. What's your views on this story? Are ifeel going to experience, or perhaps have they navigated some of the challenges that a lot of the companies and healthcare providers that you're looking at will have dealt with already or could be dealing with?
Yeah, I think first thought reading the story is it's great to see more investment in that space and also at a sort of larger size. What I found really interesting about their approach, and I think they're getting very right, is that mix of digital chat and in person. So a lot of the challenges that we see for mental health services is that they will specialize in one of those areas and have a very sort of narrow view of the pathway. And what's right for one person is not for the other. And we can't expect the digital, for example, to take away the need to talk to a person. There will always be a need in mental health for that direct human-to-human interaction. But the big challenge of that is it's very costly. And so how you match up the digital capabilities that are just much more scalable within that need, I think is one of the things that looks like they've gotten very right. I think the thing that, and without sort of knowing the intricacies of the product, that I would hope to see is how do they integrate with, match up with other health areas, because mental health is rarely stands alone and it covers across a lot of other things. So how does this, without jumping into a boring conversation of interoperability, but how does it match up with chronic disease care, with MSK pain and other areas? Because that is one of the challenges that remains here, is how we get the providers to work with each other across. And so as they will definitely expand. And I don't think that the right move there would be to expand from mental health and try to do all other health areas. But it's great to see. I think it really also is that wave of mental health being much more of a focus. And I mean, the need has clearly been there for years and is only going in one direction. So there's a number of really good providers that are raising and expanding, and I think this really looks like one of them.
Aahuti, I know you work very closely with a lot of mental health organisations, so I'd love to get your views on this one as well.
Yeah, thanks, Huw. I think where David left off is actually a good point to pick up on, that they are definitely exclusively focused on mental health, but they've gone really deep in that space in terms of how they're approaching that. And I wonder whether the next step for them is to then start thinking about how they weave in that intersection of chronic condition, pain, mental health, and sit at that intersection. And I've seen a rise in the number of companies that are now starting to move in that direction, either to differentiate, and therefore they're being opportunistic because they see that there are not many providers in that kind of intersection space, or because they recognize the tridirectional, if that's such a word, I don't know, relationship between pain, mental health, and a chronic condition. And almost, the secondary symptoms of any chronic condition is always mental health, I would argue, and very often also pain. And so I do think that it's potentially, I could see this company starting to move into that area. In terms of other views that I had when I read this article, it was difficult to it wasn't the kind of article that provokes reactions. So this is me with my time with SomX now, really learning about journalism a little bit more. And there was an article about ifeel some time ago, I think last month actually, that we discussed in a previous episode. And that was written in a completely different way, which really provoked lots of reactions and opinions. And this one is a really kind of almost like a sensible, practical report out of the facts of this milestone for ifeel. So where it took me when I read it actually was thinking we've really got to start looking at some of these companies in terms of what's making them successful, because we've all struggled to date in terms of scaling digital health businesses, and we don't have a playbook, the roots of reimbursement, business models, regulation, we're kind of forming those pathways and roadmaps as we go along. And I think when we see success stories like this, and it does seem to be a success story, I think it's important for us to kind of reflect for a moment and think, okay, so what's kind of made them a success? And when I read the article and thought, actually, all right, so what is it here that seems to have worked for them? And we are seeing a trend, right? We are seeing a trend. So I think there are some lessons to take away from this. So they definitely have this comprehensive, holistic approach to mental health. So they're going down the route of prevention and intervention. They've then got this kind of individual and organizational focus. And importantly, they've integrated lots of different modalities. So they've got like articles, emotion diaries, audio guides, relaxation techniques, so they are recognizing that when it comes to mental health and when it comes to health generally, right, we each engage with our health and we're motivated in different ways to engage with our health. And those interactions have to be personalized. It's back to something David was saying earlier around the personalization trend. And they've approached it by, having this kind of multimodal approach as well. Then they've managed to successfully scale. So these are obvious points, but they're in about 30 countries. They've got psychologists offering services in 25 languages. Now, what that means from an employer perspective is a global workforce will be catered for. And that's important. Now, that's not something every digital health solution startup can achieve overnight. You have to start with one market. Of course you do. And it's, typically sort of the language that you can scale up the most in, which tends to be English. But, they have obviously had in their roadmap that they are going to reach this scale and how they're going to do it as well. They've obviously got a digital platform for the accessibility and convenience. But what they also have got is, back to David's earlier point, personalization. They're achieving that in the fact that they've got, 30 therapy areas, which enables that personalized treatment. And then they've got over 600 psychologists specialized as well. So I think it's always helpful to break down some of these announcements and for us to start as a sector to start distilling what is it that's made this company successful and reach this milestone, because I do think we're a fast growing sector and we've had some casualties in this sector. Companies have dropped off, as we know. But then when we have these success stories, I think it's important to dissect them a little bit so that we start building up a bit of a playbook around what's going to help drive success. And that will help fund investment. It will help companies that are not at this stage almost have a little bit of a forward view around what's important.
Exactly right. I think one of the things that was interesting, and you're right, this is sort of it feels like a very sort of standard, clean announcement type one of the things that stood out to me was that there is a focus on reducing cost. And I think that that's what it didn't say is how clearly they articulate that, how clearly they show it. But I imagine that having been able to scale, that's probably one of the things that they might be doing better than others. I think one of the challenges that a lot of health providers have is we can, from a common sense perspective, articulate why this will help reduce cost over time and it'll help reduce employee turnover. The return on investment is there common sense wise, but being able to prove it and really be clear, and it's mentioned a few times throughout the article that that's part of their USP. And I think there's a clear takeaway for those building in any health space that you have to think about the buyer, and there definitely cares about the well-being of the end user, but very early on in building products, really be clear about what is the return on investment. Are you asking people to add budget? So are they doing something new, or are you improving the efficiency of existing budgets? And I think what it looks like here is that they've managed to improve the efficiency of existing budgets, maybe even reducing the need for certain budgets. That can be much more powerful than saying we've got a new and better service, but it requires more.
So I'm going to take this story about personalization and reduction in healthcare costs and move it to another arena and another condition entirely for story number 2. So story number 2 is about Ciba Health, which is using wearables and analytics to get to the root cause of type 2 diabetes. Ciba's CEO says, quite rightly, that no two patients with type 2 diabetes are the same, and chronic disease management typically takes a one-size-fits-all approach that not only costs 6 times more than healthcare for someone without a chronic condition, but is also inadequate in addressing the root causes of the condition for the individual patient. Ciba claims that it uses technologies to address these issues by providing a more effective, patient-centered, and data-driven approach to type 2 diabetes management by leveraging wearable technology, conducting extremely thorough lab tests, and setting each patient up with their own personal team of health experts based on their health needs. Compared to traditional lab tests, which only test for 50 biomarkers, Ciba Health says that they identify more than 300 lab markers that can influence any patient's given condition, and use wearables, mobile apps, and advanced analytics to track patient health data and generate personalized recommendations. It's very interesting. There's a lot of buzzwords that we try and avoid on Pigeon, if we're very honest. Patient-centric, data-driven, they're all out there, but they can mean a lot of different things. The results that they put forward, however, do seem to show some very positive outcomes. Among them, 25% reduction in hospitalizations, 30% improvement in medication adherence, 40% reduction in healthcare costs, 98% chronic disease reversal, 85% medication reduction, and £30 average sustained weight loss over 12 months. There's a caveat here that unless anyone else has spotted it in the article anywhere, I can't see any indication of how big those trials are or the studies are. We don't know how many patients that was across. So ultimately, always take article numbers with a pinch of salt, but it does sound like a very positive outcome. So, yeah, keen to get anyone's initial thoughts on this one or initial reactions from this.
I mean, I think it sounds like very impressive. Again, don't know the numbers and where they come from, but it does look like a really good application of where technology can help both the personalization, really reducing cost and improving outcomes, and capturing data from multiple sources to personalize. I think one of the things that struck me that would be interesting to understand is when they talk about 40% reduction in healthcare cost, and it's tied to reduction in hospitalizations. What is that actually? What timeline is that over? So one of the challenges that we see quite a lot is that when you're talking about reducing healthcare costs, do you do it with an initial investment that is then tied to, and this will reduce cost over a 10, 15-year period, which is great, but there needs a lot of data to back that up and a lot of convincing for that initial investment. Or is this actually a 40% reduction in year one? And that's slightly unclear, and obviously both are great, but one is a lot easier to sell. And
Yes.
I think that's this is one of the things like we imagine is a challenge here is that more personalized approach and what looks like a more high touch approach up front does really need these studies to prove and show the benefits. But looking at the numbers, it does look like a fantastic approach. Like the say with a pinch of salt, but it's very impressive from the look of it.
It's certainly the implication, isn't it? That 40% reduction. All of the other study metrics appear to be over a 12-month period as well. So, if it does turn out to be sort of a prediction or an evaluation of over the total timeline for disease management, which I think assessing a product for chronic disease management over a single year is it could be problematic at best. But Aahuti, what are your thoughts on this one?
So interestingly, some of the similar ingredients that we saw in ifeel in terms of personalized holistic care, combining wearables. They've also got obviously the software side of things. They've got data-driven insights. They're taking a multidisciplinary approach. They're focusing on prevention and, interestingly, reversal, which is like a good thing as well, obviously, and a real focus on patient engagement and education. So again, wanted to call that out because in terms of a playbook for the digital health sector, similar ingredients are now starting to feature in these solutions. I was curious about their business model because I was trying to glean that from the article. I don't think, unless I missed it, that there was any explicit reference to their business model. And I was curious about that because of the outcomes, like the results that they've achieved, and reducing medication. So 85% medication reduction is not helpful for pharma companies, and doing weight loss, sustained weight loss is also not great for pharma companies because of all these new drugs that have been in the pipeline and are now on market around weight loss. So I'm kind of wondering, how do they manage their different stakeholders here? And this is a US solution, right? If I'm not mistaken. So I think they've only commercialized in the US. So it's kind of making me wonder if they're selling directly to healthcare providers and with health plans, then people are getting better, which is obviously a good thing. We're all doing this to help the healthcare system generate better outcomes and have reduced costs and become more sustainable. So this is definitely contributing to that. But I'm just really left curious. I'd love to have a chat with this company around how are they managing the multiple stakeholders here, because pharma companies won't necessarily be overly impressed with the fact that there's less reliance on medication. They help with adherence, obviously, which is a good thing. But as we know, just improving adherence doesn't necessarily lead to better outcomes because sometimes these drugs are not effective in certain populations. So helping patients adhere to medication doesn't equate to better outcomes. So they're helping with adherence. But yeah, there's also the fact that there's a less of a reliance on drugs. So I can't really answer that, obviously, for myself. I don't have enough knowledge about this company's business model. I'm just left quite curious about it.
Yeah, it's interesting because you think that the sort of reduction in cost focus would be right up the alley of the insurers, but obviously when it comes to chronic conditions, there's always a sort of a challenge of getting insurers involved at all. And if this ends up being cost covered by the individual, there's a real challenge of reach and scalability because you then have just a target population of those that can afford health services. And I think that's a big challenge for a lot of products is that if you don't have one of the payer stakeholders really invested in the outcomes, it ends up with the individual, and that just limits it down to the sort of well-off groups. And there's been a lot of, I think, health tech that have not gotten the payer incentives right, and therefore struggle to scale beyond that sort of highly paid, high level of disposable income.
Yeah, and exactly. The article references the fact that they equip each patient with Fitbit, sleep trackers. These are not normally offered in the healthcare market. So this is something that sounds like it would be focused just on really specific cohorts. And I wonder with the US system, not that I'm an expert in the US healthcare system, but where the incentives are definitely different to the UK system, and where for a private healthcare provider, if that is the entity that's funding this, if they are the payer or whether it's the health plan providers, it's a little bit of tension then, isn't it, between those two stakeholders? Because if a patient is getting better and the diabetes is reversed and they don't have as much of a reliance on that healthcare provider anymore to take care of their health when it comes to their diabetes, and that's less payment for the healthcare provider because there's less frequent visits and less medication required, et cetera, et cetera. So I'm left curious about how are they managing their different stakeholders here to get this business model right.
One to watch then to see who pays for it in the long run, and whether the company's able to scale as a result. Our third story comes to us from Digital Health, and that's that Black and ethnic minority people are underrepresented in virtual wards. An analysis commissioned by NHS England's South East region and carried out by the consultancy PPL examined 29 virtual ward pathways in the South East, equating to just under half of the region's overall virtual ward capacity. The survey itself, the study, is about a lot more than just this issue. It's quite wide, but one of the headline findings is that Black and ethnic minority people are underrepresented and appear to have less access to virtual ward pathways. Looking at it, a percentage of the admissions who are BME is 4%, while of the relevant local authority population, 8% are from a BME background. So there's not a lot in the report as to why this is. Why are Black and minority ethnic people struggling to access virtual ward pathways? And in fact, one of the key challenges that identified is that there doesn't appear to be sufficient data at the patient level to come to a conclusion. So ultimately, the recommendation off the back of it is that further research is needed to identify the barriers and address them in the meantime. NHS England said it's taking steps to ensure that wider uptake is possible and that demographics are engaged and supported to access virtual ward services. But I mean, when we look at these statistics, there's obviously something to be a bit concerned about, that patients aren't able to access these pathways. And I'd love to get sort of initial reactions, initial thoughts as to, why this might be and how best we can address these kind of issues.
I mean, I think there have to be really concerted efforts to address these kind of issues. The data point is almost nothing new. We know that there's an issue with data. And in fact, in a conversation with Michelle Tempest earlier on this week, she was helping me understand the extent of this. And 50% of electronic health record data is inaccurate or incomplete. And then when we look at what that looks like for Black and ethnic minority patients, it's going to be even more because there's less engagement in the healthcare system by those groups, and therefore there's going to be further levels of inaccuracy and incompletion. But we know this, we've known this for years. So it shouldn't be any surprise that if there's a root cause like that, it's going to manifest and we're going to see these kind of issues, therefore spread out in all sorts of different directions. So I think when governments and healthcare systems come up with these new initiatives like virtual wards, it can be any initiative. It doesn't matter what it is. It could be a new AI implementation. It could be virtual wards. It could be a public health campaign for women or smoking cessation. There almost needs to be an immediate focus on Black and ethnic minority groups to think, how do we tailor this campaign, or how do we tailor this policy? How do we tailor this solution, the implementation of it, to actually reach those groups?
I really sort of noticed that element of the lack of data. And I think it highlights one of the real challenges in capturing this type of data is being able to articulate for the patient why that data is being collected. So we have the data that we collect that directly helps the patient. So symptoms or whatever you give to your healthcare professional. But then there is the data that actually just helps the system, that doesn't necessarily directly impact the patient. And I think those are usually harder to collect and can be left off, and it's optional. And if we don't get much better at articulating why we need it, because we do need the participation of the patients to be able to collect this data. And historically, it's a question on a form that you fill out, and it's way too long, and half it's optional. We don't really tell people how it's going to help to provide it, and have a real focus on getting it. And I think that's the cliche of what gets measured gets managed. And to be able to solve these inequities, we do need to have sufficient data to target and understand the problems. But I think sadly, this doesn't look surprising, right? It's not a headline that unfortunately that seems to be the norm. And it feels like we're just sort of recreating the errors of the past when rolling out new innovations. And I do wonder if part of that can be seen in what's the representation of those building the solutions and rolling them out, and the understanding of the communities that they need to reach. And obviously, these days we can't see the causes of it, so it's complete speculation on my part. But looking at other rollouts, there is some common themes when it comes to missing equity, and I think it's paramount that for these types of programs we really overly focus on getting a better diverse groups in and reaching communities that traditionally we don't. We can't just expect that, now that we're doing it virtual, it's going to be easier to reach people, and therefore we don't have to worry about that as much.
I think there needs to be some targeted research, right? Now, maybe it exists, so I might be doing an injustice to some great work going on somewhere. But we have platforms, right? We've got platforms like Discovery from This Labs, who are set up specifically to do targeted research, at population health level. So we need more of that, where we know enough, right? There's data gaps, so we don't know everything, but we know where we have the data gaps. And that's where I feel we should be putting some funding into targeted research to plug those gaps. And then there's also, the opportunity, but this comes back, of course, to, just funding and resource shortages in the NHS, but doing outreach activities, where we're specifically aiming to engage Black and ethnic minority communities. So, going to cultural gatherings, running community specific health discussions going actually into the community, into the town centres to raise the awareness and improve the uptake of some of these solutions, and initiatives. There are actually established initiatives as part of implementation plans in the NHS. There's been a huge amount of work around health inequalities and developing strategies for those. So there's something called Stay Safe Champions in London, and it involves people from those communities actually playing an active advocacy role to disseminate health information and address misinformation. But I don't necessarily see that as a widespread initiative. So we've got mechanisms, we've got enablers, but it's it's about how we cut our cloth. And when there are such pressing healthcare needs for the entire national population, and we're really kind of trying to deal with the smoke of this massive raging fire when it comes to backlogs and wait lists, etc., the resources and the funding and the way that cloth gets cut inevitably ends up for initiatives and for programs that support the masses. And as time goes on, we are doing more and more of an injustice to Black and ethnic minorities as a result.
So very quickly, just to touch on both of your points, what do we do in the meantime? So that, there is the tendency when we have the virtual projects to, as we said, sort of push really hard on them at the expense of the groups that we're living out of these projects. Equally, change takes time and engagement takes time, and moving the needle both on the research but also the engaging communities point. It can take time to fully engage and fully address some of the gaps we've addressed. So in the meantime, what's the balance we find around not just virtual wards but digital health solutions? How do we balance budgets, balance focus to make sure that we are moving forward, but maybe not at a breakneck speed where at the expense of everything else?
I mean, I think it's a collective responsibility. We can sit here and we'll be here for a lifetime if we wait for governments and health systems to get this perfectly right and have the resources and have the funding and have the know-how to do this. So it is a collective responsibility. And I'm glad you shouted that out, Huw, in terms of, what can we do, the we word, and also what can we do now? And I think any and all of us can take micro actions on an everyday basis to ensure that we are being inclusive. And that comes down to how we communicate. It comes down to being mindful of all of the audiences and really kind of being conscious about where and how do we reach them. And particularly when it comes to digital health solution providers, it's a question I ask time and time again in all of the advisory work that I do, is in your underlying data strategy, are you segmenting that? Are you building that so that we can zoom in and look at specific cohorts based on gender, based on demographics, based on ethnicity as well? And are we doing that? Is your data strategy allowing for that? And let's ensure that the design, the interfaces of these solutions that we're building, we're doing that really intentionally and mindfully so that the visuals that we put in, the language that we put in, is something that can resonate to all cohorts, all minorities, but also the masses. Now, that's a big ask. I recognize that. And I'm not saying that we can all be successful at doing that. But if we're not even mindful of it, if we're not even intentional about it, we're never going to achieve it. So the action we can all take immediately is to be mindful about it, that this issue exists, and not just to talk about the issue and raise awareness of it, but then to think, well, in the work that I do, how can I affect this? And if that mindfulness and that intentionality is there, then all of these micro actions will add up to something bigger than what any one single government can enforce top down.
Yeah, just to jump in, I think such is really crucial that we think about these things and bring them in from the outset. I think there's a tendency to roll things out, particularly this is sort of putting a lot of responsibility on the startups in the sort of early stage. But we build something, and then when we start to roll it out, then start thinking about these issues, but actually being mindful of it and building it into the strategy from the very beginning. And we won't have the perfect data. We won't know exactly what are the right steps to take. But having being mindful and having that thought through from the beginning, what's the strategy for this? So we make sure to capture the data, but also do something from the beginning. And it can be within the budgets and the frame of what people have. But not having it as an afterthought after we've rolled it out and then go, okay, now what is our equity strategy? And I think it is a good investment as well. So thinking of it not just as this is something that we need to do from a moral perspective, but it's also the right business decision. And that's another reason it needs to be there from the outset.
A lot to take forward there, and a good point to move on to our final story. So our final story comes to us from the World Economic Forum, 5 steps towards health equity in low and middle income countries through tailored innovation. The World Economic Forum says that the world faces a persistent chasm of health inequity, with low and middle income countries bearing the brunt of the burden. Put simply, too many people in LMICs lack access to essential healthcare services, a problem further compounded by deep-seated social determinants of health like poverty, discrimination and gender equality. To address this, it's identified 5 recommendations that it thinks could help close a lot of these gaps. Quite a lot of them sort of will be fairly familiar to anyone who follows World Economic Forum recommendations and policy advice, but just running through very briefly, these are funding a broader base of research and development to make sure that innovations are accessible and affordable. Leveraging mRNA technology, the technology behind the Pfizer-BioNTech COVID vaccine, could allow for speed of development and the ability to rapidly scale manufacturing by fostering self-sufficiency in production of vaccines and other health treatments, which can reduce dependency on often unpredictable imports, as well as boosting the economy at the same time. Addressing the unmet health needs of women and girls through greater research and development in women's health. And finally, harnessing the transformative power of AI to improve recruitment and process of running clinical trials, improving clinical decision-making and disease screening. There's 5 very interesting recommendations. We probably don't have time to do them all justice, but I'd love to hear thoughts on any that stand out to either of you.
I mean, I'd love to jump in on the AI one straight away because it's actually something that continues on from the previous part of our conversation just now about data gaps, but also it ties into some conversations that took place this week at Healthtech in Munich. There were lots of AI conversations happening, as you would expect in any health tech conference nowadays. And what I am a little bit thoughtful about on this point about harnessing the transformative power of AI is we know that the transformative power of AI relies on data. So if data is missing in the first place, then what is the data that is fueling the algorithms and, the machine learning and the models that we're building? And therefore, if there are fundamental gaps in that data for women, young girls, in terms of R&D spend, from years gone, and if we are missing that data for ethnic minorities as well, and we certainly don't have that data infrastructure or a legacy of great data infrastructure in these low middle income countries, then where is that data going to come from to actually fuel the AI, which then allows us to use that transformative power? So we're back to having to fund, that point from before. We need to do targeted research on populations in low middle income countries, on ethnic minorities, so that we can, and women and young girls, so we can start to plug these data gaps. And then we use that data, more clean, more complete research data that then fuels these algorithms. That's the point that really resonated with me from all of this, that AI is just making its way into every document in terms of the potential, the power, what we should be doing. But we've got so many legacy issues that we have to correct. It's garbage in, garbage out. And I know we all know that now when it comes to AI, and we all ask questions about, how have you trained the model, and what's the data that you've put into the model, and how are you going to ensure a continuous supply of data for the model if it's kind of machine learning, etc. And we now understand that these are the questions we need to ask. But when there's a fundamental legacy root cause here around a lack of data, and particularly for low middle income countries, we really do have to take some time to think about how we're going to solve the root cause. Otherwise, what we're doing is just broadening the gap, actually, by utilizing whatever data we can get hold of and clean up and plug in. We're actually biasing those models and building solutions for populations that we've already catered for historically. I think a couple of companies in the digital health space I'm going to give a shout out to, because I think they're doing a sterling job at trying to help in this space. It's Ada Health and Flow. Both have really taken an intentional, concerted effort to adapt their approaches, adapt their products for low middle income countries. And I'd encourage anyone that's looking at this space, perhaps to tap into what they're doing and how they've approached it.
Something that jumped out at me is that only in the third suggestion on building local regional manufacturing, it mentions how this will strengthen the economy. And I think it strikes me, it's almost strange that from the World Economic Forum that we're taking the others, and for example, addressing the unmet health needs of women and girls, that would also strengthen the economy. And I think there's a lack of focus that it's not just about investing in directly in production and infrastructure that will benefit the economy, but actually improving this broader health need, particularly, the example of health needs of women and girls, will directly impact the economy of these countries as well. And that mindset of we're investing in these things, and that is not just when we're doing it into industry of manufacturing or delivery models. And so I think that, I was surprised to feel there's a lack of a suggestion that we almost switch the mindset of when we're investing in these things, is it cost or investment? And the fact that it was mentioned one place but not throughout, I found a bit surprising.
I think definitely onto something there, and possibly something that we could probably spend a lot more time exploring if we had the time. But I think sadly we have reached the limit. I'm going to very, very quickly put a shout out on that AI point. Aahuti, I think you had some, a great point there. If you're interested to hear more about the role of AI in health in lower and middle income countries, there's a great book from the FT's AI correspondent, Code Dependent, Living in the Shadow of AI, which explores this and looks at Cure.ai's work in India, serving communities experiencing poverty and a lack of doctors. I highly recommend it. I learned a lot from it, so I think now's a great time for a shout out. Not promoting books, but still very interesting. Thank you, David. Thank you, Aahuti. It's been really fascinating to chat to you, David. If people want to learn more about HealthKey or get in touch with you, what's the best way for them to reach out?
Website very simple, healthkey.health, and reach out on email. It's david@healthkey.health. So pretty straightforward.
Perfect. Thank you, everyone, for listening. Particularly thank you for David for joining us from your church hall. I mean, it's you're in one of the more unique places someone has joined us from. But thank you for persisting. And it was great to speak to you. You can find all the stories we've talked about today and many more in the newsletter, as well as some of the best jobs, events, and podcasts in Healthtech. Go to healthtechpigeon.com. We'll see you next week. Thank you so much.